distribution system buffers stock and food security. Now, PDS in India, Public Distribution System in India, is a government sponsored chain of shops entrusted with the task of distributing basic food and non food items to the needy section of the society at very cheap prices. The PDS distributed commodities worth more than 98,000 crores in 2014-15 through 5.21 lakh fair shop prices. Rice, wheat, sugar, kerosene have been the four major items of distribution under the PDS. Now, objectives of PDS are to provide essential consumer goods at cheap prices to consumers, to insulate them from rising impact of prices of such commodities, to maintain minimum nutritional status of our population, to put indirect check on the open market prices of various commodities. Now, the PDS public distribution system in India has evolved drastically since the time it was introduced in India. Number one is targeted public distribution system. It was introduced in 1997, and under it, licenses were given to panchayats, self-help groups, cooperatives, individuals to open fair price shops, PDS shops. Beneficiaries can buy commodities like subsidized grains from such shops using their ration cards. Now, Antyodaya Anna Yojana, it aimed at providing 35 kilograms of subsidized grains for the poorest of poor family at highly subsidized rate of rupees 2 per kilo for wheat and rupees 3 per kilo for rice. Now, National Food Security Act, it is a central sector scheme enacted in 2013 by the Department of Food and Public Distribution under Consumer Affairs Ministry. The scheme aims to provide subsidized food grains to poor families. Union procures food grains from farmers at MSP and sells it to the state at central issue price. Now states then sell the grains to beneficiaries through fair price shops, that is PDS shops. Now 67% of the Indian population is covered under the scheme, including 75% of rural population and 50% of the urban population. Both below poverty line and few above poverty line families are covered. Now the beneficiaries are provided rice at 3 rupees per kilogram of for rice and wheat at rupees 2 per kilogram and coarse grains at rupees 1 per kilogram. The eldest woman in a household of age 18 or above is considered as the head of the household for issuing ration cards. This has been done to promote women empowerment. Further, pregnant and lactating women are entitled to take home rations of 600 calories per day during pregnancy and 6 months thereafter. Now, National Food Security Act seeks to provide food and nutritional security in human life cycle approach by ensuring access to adequate quantity and quality food at affordable prices to people to live a life with dignity. The act brings right to food within the framework of legally mandated entitlements. However, NFSA is faced with certain set of challenges which has prevented it from achieving its full potential. The challenges are that it will cost around 1.3 lakh crores or 1.3% of the GDP at current market prices to provide annual subsidy under NFSA, leading to fiscal squeeze. Now, improper identification of beneficiaries often lead to inclusion-exclusion errors. There has been a rise in leakages in schemes like PDS due to rampant corruption. Annual production of food grains is not sufficient to meet the requirement of NFSA. This has been accentuated by the inefficient procurement of FCI and other central and state agencies. Now, One Nation, One Card. This scheme aims to connect all ration cards to a central server and point of sale machines to all PDS shops. Doing this will enable all beneficiaries under NFSA to buy grains from any PDS shop in the country, irrespective of the state to which he belongs. The scheme will especially benefit the seasonal migrant workers. Now, issues with PDS in India after inclusion of NFSA 2013, the burden of food subsidy has become huge. The procurement price has been rising continuously due to rich farmers' lobby, and issue prices are getting lower due to populist policies. All of these together have made PDS unsustainable. Inefficiencies in operation of FCI, that is Food Corporation of India, due to highly centralized and bureaucratic mode of operation have resulted in an increase in the economic cost of FCI food grain operations. For a long period of time, PDS operations have remained little limited mostly to urban areas, and rural poor have not benefited much from PDS. Now, since there is a residential requirement for ration cards, a large number of homeless people, migrants, etc., are automatically left out of the food security. PDS suffers from leakages due to diversion of food grains to open market because of widespread prevalence of corruption. NSSO data shows that a huge leakage of 37% from PDS in 2011-12 itself. Now, due to large procurement of food grains every year by the government, the net quantities available in open market reduces. This leads to increase in the price of commodities and inflation. Improper targeting of beneficiaries has led to inclusion exclusion errors. As per National Sample Survey of 2007, 63% of the poor households were not covered under the TPDS system. Thereafter, further, NCAER reported about ghost card holders or ghost beneficiaries. Now, recent PDS reforms, digitization of all 23 crore ration cards, 56% of the digitized cards have been seeded with Aadhaar. Installation of EPOS, that is electronic point of sale devices, at fair shops to track the sale of food grains to actual ration card holders on real time basis. Some of the changes or reforms which can be introduced in PDS system to improve its functioning include: now Shanta Kumar committee in 2015 recommended gradual introduction of cash transfers in PDS, starting with large cities with more than 1 million population. Now, food coupons can be provided to beneficiaries through which they can buy food grains from store, and the dealer could be reimbursed on the production of these coupons at government treasuries. This will help reduce the problem of procurement, diversion, and black marketing of food grains. Instead of buying through PDS, government should provide a universal basic income to all so that the needy could purchase food grains as per their choice. Private sector should be encouraged to take up procurement, storage, and distribution of food grains. This would ease the pressure on government agencies and increase efficiencies. Now, government should diversify its procurement basket so as to incorporate adequate nutrition mix. This will promote crop diversification and check the skewed incentive to grow only rice and wheat. Now, technological interventions is the need of the hour in PDS system. For example, truck dispatch information and stock availability at fair price shops through SMS to registered users, and GPS based tracking of trucks carrying PDS goods can be implemented. Fair price shops can be operated with the help of panchayats, cooperatives, and self help groups, will lead to community participation and localized monitoring of PDS schemes. Now, identification of beneficiaries will improve targeting, creating a web database of beneficiaries with information on the allotted quantity of each goods as per entitlement, computerization entry via Aadhaar authentication at point of sale machines, etc. can be done. Now, moving on to buffer stocks, FCI is a statutory corporation set up under the Consumer Affairs Ministry. It procures food grains from farmers at MSP, distributes food grains to consumers through PDS, and maintains buffer stock for food related schemes to meet emergency situations like unexpected crop failure, natural disaster, festivals, etc. Now, buffer stocks are fixed by Cabinet Committee on Economic Affairs, which is headed by the Prime Minister. Central pool stocks under buffer stock were 74.3 million tons as on July 1st, 2019. However, there are certain issues with the buffer stock policy of India. Government procures approximately 40 to 50% of the total marketable surplus of rice and wheat, making the government a virtual monopolist in domestic grain market. This has led to government becoming the single largest holder of rice and wheat. This in turn disincentivizes the private sector to make long-term investment in procurement, storage and processing. As per the Economic Survey of 2020, India has become a high-cost food grain economy due to high procurement costs. Further, the inefficiencies of FCI increase with increasing level of stock it has to store. Also, India lacks storage infrastructure needed to maintain its rising buffer stocks. Government intervention in grain market has created a disconnect between demand and supply as the farmers are deriving their signals from government policies on procurement and distribution rather than the demand patterns. Now, inefficiencies of Food Corporation of India. The economic cost of food grains to FCI is the MSP along with bonus, if any, paid to the farmers, plus procurement incidentals that is paid to the drivers, loaders, etc., and distribution costs like delivering to states for the public distribution system shops, implementing NFSA, etc. However, FCI is faced with a set of challenges like inefficient inventory management by the FCI leads to excess of millions of tons of grains remaining in FCI godowns, leading to wastage of food. FCI lacks sufficient storage infrastructure. As a result, the quantity purchased exceeds the storing capacity of FCI and leads to excessive damage of procured grains. Now, FCI's cost of operations are rising due to higher acquisition cost and storage cost. It has been observed that economic cost of FCI for acquiring, storage and distributing food grains is about 40% more than the procurement cost. While the economic cost of FCI is increasing due to increased procurement, the government is not releasing subsidy funds to FCI in a timely fashion. As a result, FCI suffers from financial crunches. FCI is presently overburdened due to negligible private sector participation in food grain sector, human resource related issues like staff shortages, lack of technical expertise plagues the FCI. Now, FCI also suffers from nepotism, corruption, and bureaucratic hurdles. Shanta Kumar Committee recommendation on restructuring of FCI can be implemented to improve its functioning. Now, the recommendations goes like that FCI should hand over procurement to those states which have gained sufficient experience, like Andhra Pradesh, Punjab, and Haryana. It should focus on states which suffer from distress sell at prices much below MSP and which are dominated by small landholdings. FCI should outsource its stocking operations to private sector. Even the Economic Survey of 2020 has stated that government intervention has hurt more than it has helped and that it has no business to be in the business. Now a transparent liquidation policy is need of the hour and it should automatically kick in when FCI is faced with surplus stock rather than other than the buffer norms. At the top level, FCI should hire executives from private sectors to bring in technical expertise. Some of the steps which could be taken to improve the buffer stock policies of India are as follows. Now, Economic Survey of 2020 recommends the following, which is coverage of NFSA should be restricted to the bottom 20% of the economic ladder. Moving towards conditional cash transfers, under which poor families are given money to buy non subsidized food grains from the market. This would reduce FCI's procurement and stock keeping burden. Open market scale scheme of excess food grains beyond the storage capacity should be implemented to avoid wastage. Cold storage infrastructure needs to be built so as to conserve the perishable commodities. Private sectors could be encouraged under public-private partnership model to build such physical infrastructure. Negotiable warehouse receipts need to be implemented as it will considerably reduce the storage cost and responsibility of the government. Under negotiable warehouse receipts, farmers deposit his produce into warehousing development and regulatory authorities registered warehouses and gets negotiable warehousing receipts. He can then pledge his NWR to obtain loans from the banks for the next cropping cycle or trade it via the commodity exchange market. Now, NWR prevents distress sell of agricultural produce. Farmers can wait for the prices to rise before selling while his crop is safely stored in the warehouse. Now, WRDA is a statutory authority under the Department of Food and Public Distribution, Government of India. It implements and regulates the negotiable warehouse receipts, that is NWR, and electronic NWR system in the country. WRDA also promotes the orderly development of warehousing business in India. Restructuring of FCI based on Shanta Kumar Committee's recommendations can be done to improve its efficiencies. Now, moving on to food security. FAO defines food security as ensuring that all people at all times have both physical and economic access to the basic foods that they need. Food security is important for an economy because only when citizens are fit and secure, they can engage in productive activities and increase the economy of the country. A food secure nation is able to reap the benefits of its demographic dividend to its fullest extent. Further, when nutritional status of citizen is high, government spending on healthcare reduces, and this would open up scope for investment in other productive sectors of the economy. Now, Food Security Act, like it exists when all peoples at all times have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. It has four main objectives like availability, access, stability, and utilizations. Availability is ensured when there is a reliable supply of food of sufficient quantity and quality. It is dependent on domestic production, food stocks, imports, and food aid. Now, access is ensured when individuals and households have adequate resource to obtain appropriate foods. It is dependent on political, economic, and social factors, equitable distribution, market infrastructure, affordability, and purchasing power. Now, utilization is dependent on food safety. Utilization is ensured when food is nutritious and can be adequately metabolized and used by the body. It is dependent on food safety, food quality, nutritional knowledge, proper preparation, clean water sanitation, and healthcare. Stability is ensured when there is a permanent and durable access to food. It is dependent on maintenance of all three pillars over time and no risk of loss of supply due to economic, political, or environmental factors. Now, India's food security status. India has been ranked 94 among the 107 countries in Global Hunger Index of 2020. Global Hunger Index is an annual report published by Concern Worldwide and Wealth Hunger Alive. I think it's a German thing. The index is calculated using four indicators, which is undernourishment, child wasting, child stunting, and child mortality. India's performance on the indicators are as follows: 14% of the India's population is undernourished. Child wasting in India stands at 17.3%. Child stunting rate in India was around 37.4%. Child mortality rate in India stands at 3.7%. Further, National Family Health Survey NFHS 4 report states that 53% of women of age 15 to 49 years of age and 58.4% of children between 6 and 59 months are anemic. However, food insecurity is on rise due to several reasons like global water crisis, land degradation, climate change, agricultural disease, etc. Now, issues like leakages in the PDS, food wastage due to inadequate storage infrastructure, inefficient targeting of beneficiaries under the food distribution program, and poor last mile reach of government schemes have been a major impediment in achieving food security in India. To tackle the problem of food security in India, government provides the following food-based safety nets. PDS, which is discussed earlier, now Integrated Child Development Scheme, ICDS, Midday Meal Program, and Poshan Abhiyan. Now, Integrated Child Development Scheme is a centrally sponsored scheme launched in 1975 and implemented by the Ministry of Women and Child Development. The scheme aims to provide food, preschool education, primary healthcare, immunization, health checkups, and referral services to children under 6 years of age and their mothers. In addition to fighting malnutrition and ill health, the program is also intended to combat gender inequality by providing girls the same resources as the boys. Now, 10th 5-year plan linked ICDS to Anganwadi centers established mainly in rural areas and staffed with frontline workers. This widespread network of ICDS has an important role to play in combating malnutrition, especially for children of weaker groups. However, a 2005 study found that ICDS was not particularly effective in reducing malnutrition, largely because of the implementation problems and because the poorest states have received least coverage and funding. Also, though it has widespread coverage, operational gaps meant that service delivery is not consistent in quality and quantity across the country. Now, moving on to the midday meal scheme. The MDM scheme is a centrally sponsored school meal program in India designed to better the nutritional standing of school age children nationwide. It is implemented by Ministry of Human Resource and Development. The program supplies free lunches on working days for children in the primary and upper primary classes, which is up to class 8 in government, government aided, and local body education guarantee schemes and alternate innovative education centers, madrasas, maktabas, supported under the Sarv Shiksha Abhiyan, and national child labor projects run schools run by Ministry of Labor. For primary students, 300 calories and 8 to 12 grams of protein. For the upper primary students, 700 calories and 20 grams of protein have been kept as a norm. Now, MDM scheme aims to ensure the nutritional status as well as class attendance of poor children. However, the scheme has failed to meet its end in various regards. Overall impact of MDM has been limited due to meager allocation of resources and faulty policy designs. Nutrition deficient meals are being served at most of the schools. Due to nutrition deficient food being served, children are facing problems of hidden hunger. Now, corruption in MDM scheme is one of the main reasons of its failure. MDS is falling prey to private contractors as per a report prepared by Supreme Court appointed food commissioners. Now, moving on to the Poshan Abhiyan. Poshan Abhiyan or National Nutrition Mission is a government of India's flagship program implemented by Ministry of Women and Child Development to improve the nutritional outcomes of children, pregnant women, and lactating mothers. For implementation of Poshan Abhiyan, 4-point pillars of the mission are intersectoral convergence for better service delivery, use of ICT, that is technology, for real-time growth monitoring and tracking of women and children, intensified health and nutritional services for the first 1000 days, Jan Andolan or people's movement around malnutrition. Targets under the Poshan Abhiyan are to reduce stunting, undernutrition, low birth weight, and anemia by 2%, 2%, 2%, and 3% respectively by 2022. To achieve this target, half of the funding will be sourced from multilateral institutions like World Bank. To oversee the implementation of Poshan Abhiyan, National Council on India's Nutritional Challenges have been constituted under the chairmanship of Vice Chairman of Niti Aayog. That'll be it.